Now, let me just do a very short summary of what an in-office membership plan is. It's where you would come up with an annual fee. There's a variety of ways of doing it. This is how we recommend it. You come up with an annual fee that would cover 2 hygiene appointments with necessary records, necessary x-rays, and exams. You come up with an annual fee for that. And then they would also receive a savings on any, as a member, they would receive a savings on any service they achieve, they receive in your practice. We did the heavy lifting for you by A/B split testing and scientific split testing to determine exactly what that savings should be. So we tested different amounts. We tested 20%, 18%, 15%, 12%, 10%, and 8%. Remember, Naren, anything less than the 45% in the PPO plan would be better. Agreed?
Absolutely. I mean, 45% versus 10%.
Yeah.
You are keeping the other 35% to yourself, right? It's amazing.
What we learned was that 10% was the sweet spot.
Mm-hmm.
So that was the sweet, that was, and we did it through scientific split testing where that the data showed us that that was enough to encourage people to sign up, but reduced the impact on the practice. So that 10% is it. I'll go on record as telling you, I don't like that 10% discount one little bit, but I do like it a whole lot better than the 45 to 50 that's in your PPO plans. You're way, way, way better off. And that's not even factoring in the fact that these people don't have an insurance mindset. These people are more interested in health and how your office can help them rather than whether something's free or not covered by their insurance. So let's talk about how to attract more patients using your membership plan. I want you to think of this figuratively. I want you to think of rolling the red carpet out to people in your community who don't have insurance. Roll the red carpet out. Now, Naren, there's any number of people, groups might not have dental insurance, but there's 3 very distinct groups that come to mind. 3. Let's start at the top. Retirees. How about retirees? So if you're listening to this, I want you to ask yourself this question as I go through these 3. Do I have any of these kind of people in my community? Do I have any of these people in my community? So retirees. Now, retirees today typically do not have dental insurance. When they retire from their employment, they're usually, if they provided dental insurance, not everyone did, but if they did, you're provided a COBRA, C-O-B-R-A, it's an acronym, a COBRA period where you're still covered. And then after that, they have to get their own dental insurance. And most people don't because they don't even know how to get it and they don't qualify for groups and that sort of thing. So most people that are retired don't have dental insurance. How about go and find some of them? By the way, demographically, I also really like those people as patients in the practice. Naren, if I was given a choice of a 70-year-old new patient or a 20-year-old new patient, I'm going to appreciate the 70-year-old every time. Not that I wouldn't appreciate a 20-year-old,
yes.
but think about what is needed in terms of their dental needs. Someone at 20 might have never had a cavity in their mouth, and we love to see that. By the way, we love to celebrate people's health, but when we look at a treatment opportunity, there's not usually a lot of treatment opportunity for a 20-year-old. Talk about a 70-year-old. A lot more likelihood to have treatment opportunity available from that 70-year-old. So let's go find retirees. Second group would be the opposite end of the age spectrum, millennials. And millennials, the reason for that is that many millennials are in the stage of their career where they haven't been accorded benefits yet. Now, there are millennials who have dental insurance, but many do not. So let's go find them. Are there any millennials? So as you're listening to this, answer that question. Are there any millennials in your community? Now, there's a third group, a little harder to find, but worth trying to find, is what I call gig, G-I-G, economy workers, gig economy workers. These are independent contractors, freelancers, Uber drivers, Lyft drivers. These are Airbnb, people run Airbnb businesses, VRBO businesses, Etsy shop owners, and any number of people that kind of do that freelancing. Because the freelancing, they likely don't have dental insurance. Another group of people that we can market to. Now, again, let me ask the question. Well, Naren, I'll ask you. You're in Mississauga outside of Toronto. Do you have any gig economy workers in Mississauga?
Oh, tons of them. I mean, like Uber drivers, Etsy shop owners, eBay sellers.
eBay, yeah.
Yeah, they're like massive.
And tech,
I would say
I imagine
like hundreds of thousands of people in this.
Freelancers in tech in Mississauga?
Oh, 100%. Web designers, you programmers, Even like there's a huge trend now where they deliver, groceries to you. So there's a huge number of people after COVID. That's all they do, groceries.
Yeah. It's the fastest growing segment of the economy is gig economy.
Even
let's go
like,
find out.
handyman and stuff, right? Before we had a handyman, now you go to a website and you plug in what you want and boom, somebody shows up.
Yeah. And now, it's a trend it's growing because people like to have independence.
Yeah.
They like to wake up and decide if they're going to work or not. They're
Yeah.
not locked into a 9 to 5, and they can decide, but those people are out there.